Welcome to the Animal Free Labcast, everybody. I'm back again with Dr. Gemma Davis. Hiya, Gemma. How are you?
Hi, Carla. I'm good, thank you. How are you doing?
I'm good, thank you. And we're being joined by a very special guest today, aren't we? Your dog Leo is sitting on your lap and may make his presence known during the episode. So
exactly. He does like to interject at times, so apologies for barking in the background.
Oh, quite right, as it should be. And we have another guest as well. Gemma, who else is on with us?
Yeah, so today we're going to be joined by Dr Ethan Perkins from the University of Bradford, who is researching a new human cell model of prostate cancer.
Brilliant. Okay, well, we'll look forward to having a chat with Ethan very shortly. Before we do that, though, last week's poll question. How did it go? What have we got?
Yeah, so the question was, do you think the government's strategy on phasing out animal testing faster goes far and fast enough? So the results were 99% of people said no, which we agree with. We don't think it goes far and fast enough. But 2 people actually voted yes. So I was quite interested by that because in the media, there has been a lot of reports of people saying all the opinions from it doesn't go anywhere near far enough, right to it goes too far. If anyone would like to get in touch and let us know why you maybe think it does go far enough or too far, then do get in touch and let us know. Always interested to hear all the opinions. Yeah.
Absolutely.
So what's been on your mind this week, Carla?
Well, obviously it's been the government's new strategy and kind of some of the immediate kind of first steps that we've been doing to respond to that. So obviously we did the podcast and updated everybody about that last week. And if you want to hear about that, please go and hop onto that podcast episode. But since then, we've been doing lots of work behind the scenes, working with MPs from all different parties to raise the strategy and call for the government to enshrine all of the many positive commitments that they've made into law. So we think that legal bit is really important because we want to see these changes being committed to beyond the lifetime of this government. We think it needs to be a long-term commitment that isn't just a 5-year short-term thing. So we've drafted lots of parliamentary questions. 6 have already been tabled by MPs, which is fantastic. We've also been working with the chair of the all-party parliamentary group on phasing out animal experiments and medical research. So that's the one that we provide secretariat support for. So the chair is Irene Campbell MP. And she is drafting a response to the strategy to Lord Valence. That's going over to him. And then, very exciting, Ruth Jones MP. She is a member of the APPG and she also tabled an early day motion on behalf of us calling for Herbie's Law. She got to raise a question actually in the House of Commons at Science Question Time. And she asked the Secretary of State for Science, Innovation and Technology a question.
Thank you, Mr. Speaker, and I welcome the government's new strategy on replacing animals in science, which was published yesterday. So will the Secretary of State commit to enshrining the targets contained within the strategy in law so industry, campaigners and the wider public have the certainty that they need, that this government will move as fast as possible to end this unnecessary animal testing?
I'm very proud that we have published this strategy, delivering on one of our crucial manifesto commitments. And the Honourable Lady can rest assured, patience is not one of my greatest virtues, and I want to see this implemented and delivered as quickly as possible.
Yeah. We'll completely agree with the Right Honourable Liz Kendall there. We want it to be implemented as soon as possible as well. And we're going to be absolutely holding the government to account on that. I just want to say huge thanks to all of our supporters. So we got in touch and asked if you would get in touch with your MP and raise the question with them. So 650 MPs in the UK, 586 of them have been contacted by you guys at least one time since last Thursday or Friday, whenever we asked you to do it, which is incredible. And of those, 278 MPs have been contacted by 5 or more of our supporters. Some have been contacted as many as 16 times. So, guys, you are incredible. Thank you so much. That's just overwhelming. Thank you.
Yeah, amazing efforts. Thank you, everyone.
So we've got lots more to do and to think about. And we'll be talking more about the government strategy on the podcast in subsequent episodes because it's a huge deal for us. As I said to the team, we've done 55 years of work on this, but now the real work is really starting to begin. So
Yeah.
lots more to come on that. So Gemma, aside from the strategy, what have you been thinking about? Because obviously that's been a big part of what you've been doing.
Yeah, well, as if we haven't been busy enough working through what's been said in the strategy. These things are like buses sometimes. And we've also had through, from the Home Office, the latest batch of non-technical summaries. So these, they come through every 3 months or so. You've probably heard me talk about these before if you're a regular listener to the podcast, but if not, these are the publicly available, supposedly lay summaries of projects, applications to use animals in experiments. So it's really the closest we can get to finding out how many animals are used in experiments, what they're being used for, and what happens to them at the end. But there's also some explanation in there as to what alternatives have been considered and why they were not appropriate and why an animal had to be used. So we've talked about this before. We're not happy with how the licence process is carried out. We don't think there's anywhere near enough pushback and kind of, so we've talked about it before. Only one licence has been rejected in the past 7 years. So this is the area that we really do need to see some change, and it hasn't really been addressed in the strategy. So this latest batch of summaries that we've had through, it covers applications that were approved between July and September this year. And unfortunately, this latest batch now, I've counted up the numbers, and takes us to over the 5 million animal mark. So that means that over 5 million animals will be used in experiments over the next 5 years in British labs. And it's been 342 licenses have been approved so far this year. So we've still got one report left to come through, and then we'll know how many have been approved this year. So this breaks down, out of that 5 million, about 2.5 million of them are mice. Over 1.7 million fish have been approved for use over the next 5 years, plus specific animals like over 1,000 beagles, 1,032 beagles have been approved, and 614 monkeys, of which 92 beagles and 20 monkeys were approved in this latest batch. So, these were all approved in the year, and obviously we've just had the strategy through. So the questions that we're asking is this strategy really going to make any difference to what we're seeing going forward? And the problem is that because there is no overall date committing to ending animal tests completely, it's hard to say how much of an impact the changes that they have committed to are really going to make. The strategy only really makes commitments to ending a small number of very specific tests by particular dates. And it breaks them down into 3 sort of baskets. So either kind of short, medium or long-term goals to ending these tests. And looking like, to be honest, it is not going to make a lot of difference to what we're seeing in these kind of licenses going forward, because a lot of the commitments have been made to end tests that are required for regulatory purposes, but the majority of animal work that is carried out is for basic or applied research, and that's things done in universities and in industry. So there is at the moment no real commitment to kind of ending those types of tests specifically. So what we're kind of continuing to push for is going to be changes to the licensing programme, so that we really do start to see some reduction in these numbers going forward. But that's something that needs to be addressed, and we keep pushing for that. I'm going to be working through these non-technical summaries, and then off the back of that, we will be putting forward more parliamentary questions and working with MPs to make sure that this is still brought to attention, and we can say that the strategy, really needs to make a difference in this area as well.
Yeah.
So we'll continue breaking this down over the next couple of weeks. You can keep up to date on our social media and in our email newsletter as well. Do keep an eye out for those if you want to learn more about the strategy and what it means.
Well, and thank you for doing that, Gemma, because it's hard reading, isn't it? Some of the stuff that you're reading is pretty grim. So thank you. I know that's a tough job to do, but it's really important that we get it out there about what is actually being licensed, what's being allowed to happen. And then, like you say, hold the government to account for upholding the commitments that it's making in the strategy to try and get those numbers down.
Yeah, exactly. It's the reality of what is happening. And as much as it is really difficult to read sometimes, it's a reminder why this is so important. And we have the science. We know that it doesn't translate into what happens in people. So there's so many reasons why this is important to bring to everyone's attention.
Absolutely.
Okay, so let's introduce our special guest today. It's Dr Ethan Perkins from the University of Bradford. Welcome, Ethan. Thank you for joining us.
Thank you for having me. Great to be here. Yeah, I'm a big fan, as you know, of the charity and everything you do, so it's a great privilege to be on this.
Oh, that's so kind of you to say. We're just delighted to have you.
Oh, well, tell us about your work.
I primarily work in prostate cancer. My main interests are actually new approach methodologies, so not primarily focused in prostate cancer, but that is my main cancer of interest. And it's a really important one. When you first look at the statistics, you think it's, the survival rates are generally pretty good if you catch it early. But it affects 1 in 8 men globally. And that's quite a lot when you think about it.
Yeah.
And in 2022, there was just short of 1.5 million cases, or new cases, I should say, globally. And this is expected to rise to just short of 2.4 million by 2040, with around 700,000 deaths a year. So it is one to watch. And like I said, it starts off, you catch it early, it's quite treatable. The trouble is, obviously, it's a male taboo thing. Nobody wants to go and get a prostate check and things like that. So catching it early can be quite difficult, and it can very quickly turn very nasty. So it's one to really actually pluck up the courage and go and get the test, I suppose.
Yeah, good advice.
So you're obviously creating your prostate cancer model using human cells. Why is that important for you, Ethan? Like, what are you hoping to show with it, and what animals could it replace?
Yeah, so I think it's really important, not just for my area of research, but everybody's really moving towards more sort of human-based cell systems. Obviously, animals traditionally have been lent upon, rightly or wrongly, and they provide some relevance, but not good enough relevance, in my opinion. This is referenced in various clinical failures, such as the immunotherapy in 2006, TGM-1412, which looked really good in preclinical trials. It went through all the animals with perfect safety ratings, and it went straight into humans, and all 6 of the patients first tested on within hours developed a major off-target event called cytokine release syndrome. So animals have been shown not to be the best predictors in several cases, and I think using those human-based systems and making these more physiologically relevant clinical predictors in vitro really helps us bridge that gap into, removing the use of animals in research. And I think that's a real sort of highlight of these systems, in that we're getting close to getting these, tumour microenvironment sort of structures, which is very difficult to do, and that creates that better clinical prediction, so that we can, really justify the replacement of animals. And in terms of which animals can be replaced, well, the quick and easy one would be the mice and the rats. They are typically used for what's called ex vivo experiments, where you essentially grow a tumour on the side of them, a human tumour, and then you unfortunately harvest their organs after euthanasium. And then you do your tests on that. I think these models very quickly could be replaced by these cell-based systems, with the view of then really scaling back on the in vivo and replacing it once we are justified that we can then make the healthy organ tissues to look at the off-target effects as well. And I think those times are coming. They're getting close.
I think Leo's agreeing there.
Absolutely. Yeah.
He wanted to hurry up. Ethan, what made you kind of want to get involved in this? Because you're speaking very passionately about this. Where does it come from for you?
Yeah, I guess I've always been an animal lover. The first question that anybody would ask me when I was little, when I told them how many animals we had, was, do you live on a farm? So, animals are, built into my DNA, not to sound too cheesy. For example, my mum, she's got the lowest number of cats that I've ever known to have, and that is 8 at the moment.
Wow.
And dogs, I've never known her have less than 5. So it's one of those things. When I was really little, about 7, we lived in a 2-bedroom bungalow, and we had 6 dogs and 16 cats in this bungalow with us. So I've grown up around animals. I'm the sort of person that you'll see rolling on the floor in the street with some stranger's dog. So, yeah, I mean, nobody likes animal testing, especially people who, you know, animals are such a big part of our lives. And I think that's something that, you know, some people forget about the people that do actually do animal testing, is that if these models were here, they probably wouldn't want to do them. It's just that they're not quite, whether it's a lack of education or they're not quite familiar with these. But, you know, if we're not trying to develop these models to move away from the animals, then we're never going to do it. And I think that's why it's important. You know, I love animals. I've always been against animal testing personally. I understand that in some areas it's been very difficult to use alternatives because it's so complicated, some of the diseases we're looking at. But that time is coming, and I think unless we're trying, we're never going to finally replace animals, which is the ultimate goal, right?
Yeah, absolutely.
Yeah. So with your grant from Animal Free Research UK, because you started quite recently, didn't you? What are you planning to do with the money? How has the funding supported your work?
Yeah, so I think we're about 6 weeks in now. Started in October, which has flown by, really.
Yeah.
But no, we've made really good progress. We actually had a grant meeting yesterday around it, and Anne, who is the primary scientist, she's a PhD student of mine, with a couple of others within the institute. She's primarily looking in a different cancer called neuroblastoma, but of course she's looking at the prostate cancer on a grant as well. But she's shown some really nice, promising data of vascularized structures. So we've got blood vessels going in and so on. And this is a really promising sign that we are starting to get that sort of tumour microenvironment forming. And so hopefully by Christmas we'll have our first preliminary prostate cancer with vasculature. And then after that, it's a case of plugging in chemotherapies that we know work for prostate cancer, that we've got lots of clinical data and, importantly, animal data for. No new animals will be used, just to clarify. And this is a case of then using the data that we generate in our animal-free models to essentially compare and contrast with animal data libraries and clinical data libraries to show that these models are at least the same, if not more relevant for human predictions than the current animal methods that we use. And this will highlight not only that, you know, using these human cell-based systems are more relevant in predicting the clinical outcomes, also actually that it's more ethically friendly, which I think is an obvious one, but also it's more financially viable. Animal testing costs a lot of money in these in vitro systems. Whilst we don't do it for, you know, saving money, as much as a Yorkshireman in me would care to say, it is a big pull as well, and it's a sort of a win-win situation. You know, if we can get these models that better predict clinical outcomes, that are more ethically friendly and cheaper overall, why wouldn't we? It's a no-brainer to me.
Absolutely.
Yeah, exactly. So many benefits.
Sorry, my dog's now growling. Hang on. Here he is. Having all the dogs today. Right, sorry about that. So, Ethan, you mentioned there that you're going to compare your animal-free data to animal use data. Why is that still important? Can you just explain for people listening who maybe don't know, like, why that's helpful?
Yeah, so we'd be a bit hypocritical if we were saying we're making these human-based models that are going to be better than animals if they weren't actually shown against animals. Because if they turned out not to be better than animals, then we'd have various clinical disasters, because animals still lead to these clinical disasters anyway. But if we can show that they give the same results as the animals, or even more, you know, human relevant, which some organ-on-a-chip companies have in certain applications already, then it highlights that actually, why would we use animals when we have a better, more predictive system for predicting human biology?
Brilliant, thank you. I think that's a really important point to make, isn't it? Because yeah, I think people might not really get that.
Mm-hmm. Yeah. And it's a sort of an organ-on-a-chip system that you're using, isn't it? Could you maybe explain a little bit how that works for everyone?
Yeah, so organ-on-a-chip, I'm giggling to myself because people have really different ideas. I actually had one person think it was a physical potato chip. But a lot of people think, sounded tasty, I'm not going to lie. But,
Let me have some organs with chips, please. No, thanks.
But other people picture sort of what we'd all, or what most of us would think it was, which is a sort of a microchip like a computer. And what it actually is plastic or glass-based system with lots of different what we call microfluidic channels, which are very small channels. And within these channels, you can do things like grow a 3D vessel, or you can embed your cancer spheroids, which are sort of miniature tumours, or any sort of miniature organ in place. And then you can use flow or various different techniques to replicate what would happen in the human system. So at the start of the grant, we're looking at what I would say is semi-organ on a chip, using a plate-based system where we essentially embed triculture cells, so 3 different types of cells. So we'll have our tumour, some supportive cells called fibroblasts, and blood vessel cells called endothelial cells. And we'll put them all together in this already optimized concoction of cells, sort of a cocktail, if you like. And we'll embed them within a matrix, which is collagen-based, which is the most common matrix found in the human body. And we'll look to essentially let that grow, and then we'll be able to test drugs on it. And when we're ready, we'll then move that over to our, what I would call true organ on a chip, which is our microfluidic platform, where we'll then start circulating using a pump system, the media and the drug treatments, etc., through, which would mimic sort of blood vessel delivery, an IV in the clinic. So these organ on a chips are able to really get close to replicating the real thing. And the beauty of these pump systems is you can then daisy chain different organs together to try and get that sort of systemic approach as well. So you could have your diseased tissue alongside healthy tissue and so on to see off-target effects as well.
Amazing. So that's going to be sounds like a little kind of mini clinical trial in an organ on a chip kind of thing. So you're going to be actually able to test drugs. Is there going to be an eventual impact for patients with your research, Ethan?
Yeah, I mean, I'd love to say my institute is very focused on drug discovery. So we typically repurpose chemotherapies, which are inherently known for their toxic side effects. Yeah. Some people often don't appreciate that actually when people's hair falls out during chemo or they get very sick, etc., that's not actually because of the cancer, that's because of the chemotherapy. Yeah. And that's a treatment because it attacks rapidly divided cells, which is your hair, etc. And it's cancer patients often bar a bit of pain and tiredness. They look like normal people, they look like healthy people, and there's not much going on. It's when they get the chemotherapy and it attacks everything. It's very easy to treat cancer and kill cancer. It's just very difficult to do it without harming the patient and potentially killing them. So our institute repurposes chemotherapies to make them more targeted and selective so that they only target the tumour or minimise the healthy damage. And we've got several lead compounds. One is going into clinical trials very soon, which has shown really good data. But yeah, the ultimate hope is to move it forward so that we can use these models as a screening platform or an animal alternative as well, right the way through preclinical trials to get these new drugs to patients. But also what I'd really like to see in the future would be this avenue that's becoming more talked about now with NAMs is personalised medicine. Yeah. So we could get a prostate cancer patient, we could get a biopsy, so we could get some of their tumour cells out. We can then grow it in our lab over the course of a few weeks, and then we can actually use that to screen and select the therapy that's going to work for them. And this will save patients time in getting the right treatment quickly, but also a lot of undesirable side effects because chemotherapies traditionally you become resistant to them over the course of time. Some people are very resistant to start with certain ones, and some people are never going to be treated by chemotherapies. They need things like immunotherapies, etc. So by being able to screen that within the lab within the course of 2 to 4 weeks, in some cases, would actually save the patient a lot of illness and harm. I know it's delaying treatment a little bit, but if it's the right treatment that they then get, it's a good compromise.
Yeah, absolutely. That's super exciting. I mean, that's the dream, isn't it?
Yeah.
That golden question. How far away do you think that is, Ethan?
How long's a piece of string?
Yeah.
It's a really difficult one to say. I'd love to say, we're 5-10 years out, and we could be, but you don't know. These are very difficult things. It's not like creating a new animal model where you're tweaking one that they've already made. New approach methodologies are starting right at the beginning, and there's been some great progress from companies, Mimitus, Emulate, etc., who are all relatively young companies. I mean, the organ on a chip field probably only really got going 2010, 2013.
Yeah.
So it's a very new field, and the progress we've made in such a short time is extremely impressive. So all being well, I'd like to say, 5-10 years, but it could be longer because we don't know. But for certain diseases, we'll get there sooner, and for others, it may take a little bit longer. But I'd like to think that eventually we can get there for everybody.
Fantastic. There's a clue in the name, isn't there? New approach methodologies. Yeah. Before we let you go, Ethan, just a final question. So you were listening to Gemma and I talking about the government strategy there. What are your thoughts on it? Do you think it's a cause for celebration? Do you think it goes far enough? And how do you think it might impact you as an animal-free researcher?
Yeah, I think it's a bit of both, really. I think it's cause for a small celebration because at least something's been said. We've been expecting it for a long time, and I think in some areas they've been a little too optimistic. I think there was it 2030 to significantly reduce pharmacokinetics in drug testing. That's a very difficult thing to do, and that typically relies on animals because we don't yet have all the systemic organs ready and linked up. So I'd be very interested to see how that one develops. But I do think in some areas they could be a bit better. They make this big point at the beginning around, we've reduced animal numbers in 2024 compared to 2023, and I can't remember the exact number, but it worked out something like 0.3% or something like that, which is just not really worth shouting about, in my opinion.
I think we called it pitiful. Was it? Yeah, it wasn't very much at all. I've forgotten the number now, but yeah, it was a pitiful number, we felt.
Yeah, and I was shocked, actually. Obviously, I've been around research groups that have done animal testing, but I was shocked to see that 24% of all animals used was actually just in the making of new models, which are, gene knockouts or gene overexpression and things. That really alarmed me. I think it worked out something like 658,000, which, we could do this in vitro as well, because we can apply those techniques to cells and these spheroid models that we're developing as well. So, yeah, that's a lot of animals and such a large number of that. Was it 2.64 million or something like that that was used last year? Yeah. Significant proportion. So yeah, in some areas I'm very pleased that we've seen this roadmap, and because it shows great progress. In other areas, I think it doesn't quite go far enough. But I'd be very interested to see what the MHRA and then on the back of that, the EMA come out with next year or maybe the year after, because these legislations take a long time, to see whether they're going to start really applying the pressure. Because at various meetings, we talked about a little bit at the Replacing Animal Models conference in March, that who's going to make the first step. So it's good to see that somebody has made this first step, and I know the FDA started it in 2022 or the end of 2022. But to see it over this part of the world, I think it's good to see, and I'd be interested now to see who else takes the next step.
Yeah, absolutely. Yeah. Well, we're going to be carrying on holding the government to account, making sure that it goes as far as it says that it will, and further yet.
Well, thank you so much for joining us, Ethan. It's great to hear all about your work and very inspiring to, hear you talk about what this could potentially mean. So thank you so much.
Yeah, thank you.
Thank you. It's been great to be here. Really enjoyed it. I just love talking about what I do and hearing about other people's opinions and so on. So no, it's a great pleasure.
That's that's all we have time for in this episode, but we'll be back in a fortnight when we're going to introduce you to our Head of Science, Dr Rostobi, and we'll be talking more about the government strategy, what it means and the next steps. Before we go though, Gemma, what is this week's poll question?
Yeah, so the question is, should the government strategy prioritise replacing animal experiments in cancer research? So for some context, last year over 182,000 animals were used in cancer research. So you can vote yes or no, and you can vote on X, LinkedIn, Facebook and Instagram, and we'll discuss the results in the next episode. But if you'd like to get in touch and tell us your thoughts about the episode, the strategy or anything else, then do drop us an email at hello@animalfreeresearchuk.org.
And just repeat the question one more time, Gemma, just for people at home.
Should the government strategy prioritise replacing animal experiments in cancer research? Yes or no?
Well, I wonder if that'll be a 99%. We'll see.
We'll see. You never
So
know.
often they are. Well, thank you all for listening, and thank you all for contacting your MPs, and we'll see you in a fortnight.
Yep. Thanks for
care.
listening.
Bye for now.